Hi, very good evening. So hope it is streaming fine. We'll just start with some music, okay? So we have some different music altogether today. So basically, he's surprised and shocked with the kind of music we're playing today. Right. By the way, it's some kind of African folk, rumba saber, the name of this song. I mean, we have more or less music over there. So it's a short track provided by YouTube. So it's for free. We can play that for free without any copyright infringement. So today we shall have this image-based discussion. I've selected few images. We shall have a discussion pertaining to those things today. Right. Once again, a very good evening. Yeah. Hi Pooja, Prithvi, Srish, Nidhi. Hi Ajaj. A very good evening. Hi Ashina, Mega. Yes, Pooja. I hope it's streaming fine. Yeah. Hi Niharika. Hi Tilali. Yes, Rishabh, Bernice, Anobili. So Nidhi, you say it's great. This is the language nobody speaks in new rules every year and we simply can't understand. What is this NBE? Okay, Nidhi, right. Hi, Ananya. Right. So we shall start with today's discussion, right? So first of all, we have few images over here. So can you guess the importance of this image? It's from your Philips. All these images from your Philips 12th edition. So what does it represent? You can see it's a mandible. So obtained during excavations during 700 AD in Honduras. So you can clearly make out that there are three implants over here. This is just for information I'm just giving you. Nothing much significance in entrance point of view. So you can see that you have three implants which are carved from seashells. So it was found, dated way back to 700 AD. So maybe around 1300 years or 1400 years ago. So what does it mean? So these implants or any artificial material as implants are being widely used even during that period. And these implants, as you can see, there is some calculus. So these are your natural teeth and these are your calculus, right? So what does it mean? It means these implants are not only for aesthetic purpose, but also they serve this fixed functional and aesthetic purpose, right? So way back in 780 itself, they had this concept of implants, and you can see clearly these implants from a mandible which is dated back to 700 AD, found in a place called Honduras. Right. So we'll just go to the next image. By the way, we're not going to have only these kind of images today. So just for a difference, I just placed two images. So here you can see the second one. So Mayan culture, civilization, where they used various colored stones as well as inlays for aesthetic purpose or for decorative purpose, right? So let's proceed with few important points today. Yeah. So this, you can see a class 3 or class 4 restoration, class 4 cavity with silicate restoration. So while discussing silicate cements, we have we previously discussed that silicate cements, even though they're the first aesthetic materials to be introduced, they're the first tooth color materials. But the major drawback we have with these silicate cements is that they are most irritating to pulp, even though they have this fluoride release ability. And also you can see that the surface texture is completely lost. I mean, the color is not matching with time. There is surface degeneration, and also you can see marginal staining, isn't it? So I think this is, you can see both restorations, right? So even though it is considered to be a first tooth color restoration, it's not so aesthetic. And moreover, we need a kind of moisture environment in order to have a lifelike appearance, or else, for example, in case of dry mouth patients or xerostomia, there can be loss of water, dryness. Increasing dryness can lead to loss of surface texture, and it becomes dehydrated, right? Hence, it's mentioned that silicate cements are contraindicated in case of mouth breathers, right? I hope you know all those points, right? So this is a class 3 and a class 4 cavity showing silicate cements with surface degeneration and marginal staining, and also there is some kind of discoloration, so it's not so aesthetically pleasing. Yes, yes, it's from Egypt. Now, yes, Neetu, very good evening. Yeah, so this is a class 2 restoration. You can see that it's a direct filling gold, which we had discussion previously. The reason why I placed this image is you can see how excellent the marginal adaptability is. So the marginal adaptation is really perfect. So direct filling gold restorations, once done properly, right? Once compacted efficiently, you can produce aesthetic restorations or high quality dental restorations or gold restorations, as we have discussed few criteria in order to produce these high quality gold restorations, right? So this represents a class 2 cavity which is restored with a direct filling gold. Now, often we have this discussion regarding surface energy, and also we have this discussion regarding how the bonding actually happens, right? So in the concept of this wetting and contact angle, we might have discussed about surface energy. So what's this surface energy all about? As you can see, this is a space lattice with various atoms. So this is a schematic representation, right? So as you can see, we have atoms which are present inside and surface atoms. So those atoms which are inside are equally surrounded by neighboring atoms. So their energy is being balanced all over. However, those atoms which are present on the external surface, they are not surrounded by atoms on this area. So as a result, they have these unbalanced forces. And these unbalanced forces, we call them as surface energy, right? And also we discussed this concept of surface energy, especially while talking or while dealing with conditioning of cavity. Morning also, yesterday also we had this discussion regarding conditioning, right? So we do conditioning in order to remove smear layer. And also most important, in the process, we try to increase the surface energy, right? So this surface energy forms the basis on which there is better wetting, better penetrability, and also better bonding, right? So this represents your surface energy, right? I hope you guys are able to follow, right? It's very simple to understand and also equally interesting. So what does this image represent? Hi Geeta, a very good evening. Yes, Bernice, definitely. If at all I come across or any notification pertaining to any exam, we'll definitely let you know. AIMS, AFMC. Okay, you're talking about our National Board of Examinations. Okay. Now I got what Nidhi is trying to say. Right. So we have like, okay, when you say hue, chroma, hue, value, chroma. So what does this system represent? As I say, it's hue, value, and chroma. Metamerism? No, Preeti. Metamerism is quite a concept which is quite different. Depending upon the source of light, the color of the object appears to be varying, right? So that's metamerism. We also had this discussion in one of the videos in e-classes. I posted one video on additional points in dental materials in e-classes. You can just refer that. We had some discussion regarding it. So Mega, you say no idea, right? Hi Kalpana. Color scale, yes. Hi Nitika. Dimensions of color, yes, of course. Hue, value, and chroma, they're called as 3 dimensions of color. Okay. Sahiti, Munsell color system. Good. S. Sanchita. Hi, Militia. Hi. Yes, Abhishek, definitely. If at all any info regarding an exam, I'll let you know for sure. Yes, it's a 3-dimensional Munsell color coding system, right? Yeah. So 3D Munsell color space, where it represents 3 dimensions of color. So what are these 3 dimensions? As you can see here, I mean, can anyone try, like we have this, I mean, from the bottom, if you see, you have this black cylinder here, and from the bottom towards the top, you can see black being converted to white. So what does it represent? And also you can see around the circumference of this 3-dimensional space, color space, there is a change in color. So what does this represent? And also with each block, in the sense from the center towards the radius or towards the periphery, the color seems to be varying, right? So what does each of these dimensions represent? So as you all know clearly that hue is nothing but color. Hue is, for example, if I say red, blue, green, so these are hues. But if I say chroma, chroma is nothing but degree of saturation of hue, as you all know. So you can have light yellow or dark yellow, something like that. And what about value? Value is amount of lightness. So the more lighter or the more whiter color is, we call it as high value. The more darker, you consider that to be having low value. Also, we discussed this the same in our e-classes also. So when you add up some stains to a porcelain or any aesthetic color restoration, so obviously there is decrease in value, right? So as you can see here, yes, Nidhi, Preeti. Yeah, right. So if you see, you have this long axis from the bottom of the long axis towards the top. This scale represents value. So there is increase in value, right? And you can see that around the circumference. So you have around the circumference, you have different colors, yellow, different shade, orange, red, pink, something, different shades, right? So this circumference represents hue. Whereas chroma is nothing but degree of saturation. For example, just select this yellow, we have towards the center, light yellow, very light yellow, somewhat light, moderately light, and heavily, I mean, not light, but yellow. So it is almost a minimal yellow in color. So as we go on, or as we move on from the central axis towards the periphery along the radius, then there is intensity, increase in intensity of one particular hue, which is nothing but chroma, right? So this is very important. So long axis, along the long axis, we have this dimension of value. Along the periphery, we have this dimension of hue. And from the central axis towards the radius, we have this dimension of chroma, right? So these are 3 dimensions of color represented by Munsell color space. So this is Munsell color space. Hi Sishank, a very good evening. So this is just a representation to show you, I mean, I'm quite sure you're all familiar with this. So this is a custom tray, or is this a custom tray? So let me know which is a custom tray and which is a stock tray. I'll just zoom in for you. And also, what is the advantage of custom tray or stock tray? Or when do you go for a custom tray versus a stock tray? So as you all know, custom tray, it's customized, so minimal material is needed to produce an impression. And most importantly, it's possible to uniformly record all the areas in the oral cavity, all the tissues, and the thickness of impression material is going to be uniform. So as a result of this, distortion chances are very much minimal. But if you take a stock tray, you can see that you might not be able to cover the entire vestibule because of the deficiency of flanges. We're not sure about it. And also the thickness of the impression material greatly varies because of differences. And as a result of which there can be distortion of the impression material, right? So these are some of the problems we have with custom tray versus stock tray. So can you identify which is custom tray and which is stock tray? Yes, Regina, you mean both? Yeah. So yes, Rishabh, Regina, Ashina, Prithvi, Sanchita, Ajaj, right. Yes, Niharika, Pooja, Neetu, Abhishek, Preeti, Mini. Yeah, Mega, right. So you can see the left one. Let me just zoom into the maximum. It appears to be like tooth colored acrylic for me. So usually we have this pink colored acrylic. So this is your custom tray. And we have this stock tray, perforated stock tray, right? Now, this I feel is more important equally. So can you identify what these materials are and what are these systems to be more specific? You can just make a guesswork even though if you're not sure. Yes, Nazreen. Nidhi. The left one is custom tray. I think you can make out the difference, right? Custom tray, you will take a primary impression, make a cast, and on that cast, we'll adapt wax and then use self-cure acrylic to make this custom tray, right? We have these stoppers, tissue stoppers and all. Yes, Preeti. Good. You said zinc oxide original paste. Yes, Sanchita. Benis, you call this gun? Okay, good. So you have a gun, trigger, right. So light body, mixing tips, good Rishabh. Yes. Plunger, right. Lasers, okay. Proxa brushes, okay. Let me just zoom in. They're not really proxa brushes. It appears to be like one, but these are also mixing tips. So overall, these are all like different means to mix, your elastomeric impression materials. So as you can make out, just give me 1 second. Right. So as you can make out here. So by the way, this is not zinc oxide original impression paste. This is like we are using elastomeric impressions, like different means of mixing or manipulating elastomeric impression materials. So I mean, unfortunately, we don't use it in our undergraduate level in most of the colleges. So postgraduates, prosto, endo, I mean, we tend to use this material. So at least you'll have some idea. Or else you can just go through these images and also some videos in YouTube for better understanding. So you can see we have this glass slab or kind of a mixing pad on which the material is dispersed so that we can hand mix this impression materials, right? Elastomeric impression materials. So A represents hand mixing, basically. So we have a mixing pad on which we have this base paste and catalyst paste, right? So yeah, light body obviously, or medium body. And then you have this B again. See, all these more or less represent the same, like mixing of your elastomeric impression material. So B, as Bernie rightly said, we have this gun, a handheld gun with a trigger. So this black one represents a trigger, and then we have a plunger inside. So we have plungers inside. So let me just zoom in. So we have this plunger inside, and we have this trigger. The moment you press this trigger, the plunger inside moves anteriorly and pushes this base and catalyst paste together into this mixing tip. So mixing tip, you will have around 11 kind of barriers inside. So because of these kind of barriers inside, because of the orientation of the barriers inside, there will be mixing of this base and catalyst paste, and then you'll be getting the mix, completely mixed, mix outside, right? So this represents your hand mixing, the A, right? So let me just zoom out. So A represents your hand mixing, B represents your static mixing using your handheld gun, and then C. So these are not proxy brushes, these appear to be like one, but these are not proxy brushes. So these are again static mixing tips using syringe model. So we have a gun model previously, and this is a syringe model, right? So static mixing, syringe model. And then this is a dynamic mixer where you use a motor driven instrument inside. So it's a dynamic mixer, again for the same, for mixing or manipulating your elastomeric impression materials. We had one demo during our post-graduation where some people came from Mumbai to demonstrate their company's mixing materials, 3M I think, I'm not exactly sure. So we had seen this. So obviously the mix obtained by these motor control devices are much more superior in consistency as well as in control. I mean, when you're trying to control this material or when you're trying to use these materials, you'll obviously have a superior feel compared to hand mixing, right? So these are various means through which you mix your impression materials, especially elastomeric impression materials, right? So we have this hand mixing, so we have this static mixing, gun type and also syringe type, gun model or syringe model, and this is your dynamic motor driven mixing, dynamic mixing, right? So I hope it's clear. Oh, Regina, you're using it widely. Good. So we had this chance to just observe the demo and to use it only once. So it was from 3M, right? Yeah. Yeah, we have these spiral tips, right? And the orientation of spirals is also very important. It's mentioned that orientation of spirals inside the mixing tip is around 180 degrees, right? So we have around 11 such contra-angled spirals inside this mixing tip. Yes, yes, Prithvi. Right. So we'll proceed with the next one, right? So what does this represent? I can't really zoom in, Max. Can you see the numbers out there? Yeah, I think it's fine comparatively. So what does this image represent? You can see 3 compartments or 3 chambers. This is basically material. So to show us the material that placed it here, you can just omit them. You can see 3 compartments, 3 different temperatures, 209 degrees, I mean it's Fahrenheit, it's in Fahrenheit, 209, 151, 110. So which translates to approximately 100 degrees centigrade, 63 or 65 degrees centigrade, and this will be around 40, 37 to 40 degrees centigrade. So what does this image represent? Agar? Where is agar here? You mean to say, this is agar material. So this is a syringe for carrying agar, and this is your tray where you can see two projections here, one inlet and one outlet for movement of cool water to fasten gelation time. So what does this entire image represent? So as you said, yeah, second one is syringe, third one is tray, water coolant tray. Yes, Najreen. Yes, Bernice, Nidhi, Niharika. Yes, Sanjita. So this represents your compartments, different compartments used for softening your agar, storing and tempering your agar, right? So this is conditioning unit for agar impression material. So this image represents conditioning unit, right? So you have the values here in Fahrenheit, right? Either Fahrenheit or degrees centigrade. Try to remember one. So usually we have questions on degrees Fahrenheit. So I'm sorry, degrees centigrade. So it's better to remember centigrades, right? So as we can see, the left one, there is a liquefaction compartment, liquefaction temperature of 209 Fahrenheit or around 100 degrees centigrade. And this middle compartment is for storage. Storage 151 degrees centigrade or approximately 65 degrees centigrade. And the extreme right one is tempering. So it's around 37 to 40 degrees centigrade. Yeah. So 37 to 40, approximately 45 degrees centigrade. So 110 translates to 45 degrees centigrade oral cavity temperature. I mean, to the point where the oral tissues can resist heat or can tolerate heat, right? So liquefaction temperature, storage temperature, and tempering compartment. And also we have this water coolant tray where we use cool water at the temperature range of 18 to 21 degrees centigrade for a duration of 3 to 5 minutes to hasten or to increase the gelation process or to decrease the gelation time, right? So I hope it's clear, right? Conditioning unit, conditioning unit, CONDITIONING. Conditioning unit for agar impression materials. Yes, Nidhi. Right. So, what does this image represent? So, what do you have this? You have some cake, some piece of cake, and some sticks. Yeah, in that rimlock tray, you have channels, right? You have two channels where you have this facility to flow this water. So that's specially designed for use for agar. So it's impression compound, green stick, wax, type 1 and type 3. Okay. Yes, thermoplastic impression material, impression compound, right? Yes, so this image represents you have impression compound, type 1 impression compound in form of cake, in form of sticks, right? So the melting ranges for green, this is green in color, gray in color, and this is red in color. So soft green, the melting range is 50 to 51.5 degrees centigrade. And just make a note of these melting temperatures, right? So melting temperatures range for this green stick, it is around 50 to 51.1 degrees centigrade. And for gray, it is 53.5 to 54.5 degrees centigrade. And for red, it is 54.5 to 55.6 degrees centigrade. So these are melting ranges or melting temperatures for your type 1 impression compound, right? So I would like to do more of image-based questions, but due to time constraints, so I had to limit this discussion only to these 10 images, right? So we shall have more and more image-based discussions in future. So every week we're trying to incorporate more or less 1 to 2 image-based discussions, right, and virtual classroom sessions. So we'll stop it here. We'll have more such questions in near future, depending upon the schedule, and we'll try to cover as many as possible, right? So this completes our discussion. So you have any questions, as I keep on saying, any questions, drop a mail at proudtobedentist@gmail.com. And a final reminder for all of you. So exams, as you know, they're approaching and there is nothing to worry regarding negative marking. We have clearly stated that a negative marking everyone who works hard, who is a serious candidate, rather than a person who takes it for granted. So it is a boon for all of you. So take it in a positive way because we have no other alternative now. So make sure that you make maximum use of the available time. So as I said, we'll be converting all our tests into based on negative marking. So it takes some time for us to convert all our MCQs into native based. So I mean, in the meantime, we have completed demo tests and daily tests. So we have converted all of them into negative marking format. So from now onwards, the coming tests, everything will be incorporated in the same fashion. So we'll be having 1/4 negative marking. And the previous tests, which were covered so far, will take some time, maybe maximum of 3 to 5 days or maximum of 1 week, and try converting them all in the latest format possible as soon as possible, right? So you have any ambiguity or any questions pertaining to this new format, you can drop a mail and I will reply you as soon as possible, right? This is all type 1. This is all type 1 impression compound. Okay. So actually plan to have midnight session, but I know it's really irritating to have this session till 2 o'clock. So I was decided to have it by 10:30 or 10:40, right? So we had some beautiful music in the beginning. Even my pet started worrying after listening to that music. Right. So we'll break then. So I wish you all the best. Don't feel or don't get demotivated at any point of time. We still have adequate time. So focus on your preparation. Make sure that you give your best possible, right? So we have these groups, we have these discussions happening round the clock. You need not worry about the exam pattern, as I keep on saying. Exam pattern, when it will be conducted, when will you have this kind of online registration? That's not your headache. So whenever there is some news or information regarding that, it's our headache to inform you, right? So it's our responsibility. So just leave out everything. Assume that you'll be having exam in the month of December. So prepare accordingly and make sure that you make maximum use of time and have this conference as we discussed in the previous session on how to handle negative marking. 3 factors play a key role. It's your memory, it's your ability to recall the time of exam, and most importantly, it's your grit and self-confidence. So all these things come with practice. So practice as many multiple choice questions as possible and make sure that you give your best. And rethink before answering any question. And if you can rule out 2 options in any question which you have no idea, then try answering that question as well, right? We have already discussed all these strategies. Again, we'll try to have a separate session on how on discussing these important changes in our NEET. If at all there is any prospectus being released, we shall have one discussion in detailed manner. You need not worry regarding the exam pattern or anything. Just leave it. Focus on these particular things, right? Memory, ability to recall, and most importantly, confidence, which comes with practice. That's it. Only these things have to be there in your mind right now, which will be very much beneficial. And this is going to make a positive move in your career as well, right? So wish you all the best and a good night. Yeah, Amit, you can just drop a mail at proudtobedentist@gmail.com. We'll send you the group link. Okay? Yes, Prithvi, we'll have live sessions only by 9 p.m. every day, maximum of 9:15 p.m. But today we actually should have a morning session. So since we had to postpone it, and also we planned this midnight session, I had to place it a bit late. So anyways, we'll have it around 9 to 9, maximum 9 p.m. every day. But Thursdays and Fridays we'll have morning sessions of 5 a.m. Right? Yes, Komal, drop a mail at proudtobedentist@gmail.com, right? Yeah. See you all then. Good night. Take care. Yes, by the way, these images are from Philips, from the 12th edition of Philips, right? Yeah, bye. Take care. Yeah, Shubratri, Shabake, and Spokojnoj Nochi.